Welcome to our presentation on Bedside Report and its place in evidence-based practice within the nursing profession by Timothy Hunter, Lacey Jackson, Angela Sabetta, and Samantha Morgan. So what is report in general? Report is given during the handoff between the incoming and the outgoing nurses. Most commonly, report is exchanged in a private or semi-private setting where a patient is not in attendance. Report can also be given at the bedside with active involvement between the patient and both nurses, both the incoming and the outgoing nurse. So there's two methods, most commonly, as previous said, is closed door report versus bedside report. So what is bedside report? Bedside report saves time. Bedside report improves patient satisfaction. It reduces falls. It reduces call-light use. It reduces skin breakdown, improves safety, and gives an immediate visual of the patient right in front of the incoming and outgoing nurse. Just a quote from one of the articles that we researched states that the bedside report saves time. Some reports identified genuine safety benefits, improves patient satisfaction results in the post-implementation of the bedside report. Nurse satisfaction was increased despite fears of confidentiality violations and uncertainty surrounding speaking significant aspects of patient's care within earshot of the customer. Now, the more common method is the closed door report, where a nurse exchanges information with the outgoing nurse in an area where the patient is absent and where other nurses are within earshot primarily. And the benefits of this is that you're able to discuss sensitive issues, and you can also discuss private matters such as difficult patients, difficult family, or just as an example, if the patient's a hard stick. That's something that you really don't want to express right in front of your patient, exchanging report. That could be one of the downsides of having to do a bedside report. And so one of the nurses did express this in a quote from the same article, that participants indicated that there were instances when they cannot freely talk about everything in front of the patient during the bedside report. Nurses reported feeling freer to talk about the patients away from the room. So there are a few myths of bedside report, and just a few of these are located to the left, which are repeatedly present in all of the articles that we researched, and a lot of them were prior to actual implementation of bedside report. So when nurses were asked, why don't you want to do bedside report? A lot of them just kind of made things up. So they said that bedside report takes up way too much time. Patients are going to get upset at what they're hearing, like I talked about earlier with a hard stick or upset family. It increases overtime, it takes up too much time, and then the hospital has to pay each nurse overtime. It can violate confidentiality when somebody can hear what you're saying in front of the patient that the patient may not want them to hear. And then it also can include sensitive information. So what the facts really are, based on the evidence that we came up with in our articles, was that bedside report actually saves time. And in this little clip right here that I took out of an article, you can see that the end of shift overtime decreased 15% overall when changing from closed door report to bedside report. And then, although this next little clip out of an article is a little blurry, patient satisfaction increased immensely. So this article talked about an implementation at a 3-month period, and another check on the stats 13 months later. So all of this information is post-implementation. The first section is after 3 months, the next is 13. So what they found is that patient satisfaction based on surveys that were offered to each patient showed that they had so much more satisfaction, they felt more confident, more comfortable with the nurses once bedside report was implemented versus the closed door report.
When we look at taking this study and linking it to our everyday practice as RNs, what we want to look into is how we're going to make it relevant to push not only nurses, but also the administration to make bedside report a part of everyday functioning of the facilities. When our group started putting together this project, we discussed how report is done within our facilities. And within all four of us, no one's facilities did a true bedside report. Only 50% of our group completed a modified bedside report where the majority of the information was given at the nurse's station. And after the nurse's station, they would visit each patient's room and do a brief introduction and perhaps some small pieces of report. So it is with this that we make it our goal to ensure that the level of satisfaction in patients is higher when provided with a proper bedside report, as opposed to it not being done. Since the introduction of bedside report in all kinds of different facilities, it's been shown that there's a drastic decrease in the amount of falls and a drastic increase in patient satisfaction. San Jacqueline and Sherman in 2014 suggested that there was a 50% decrease in falls and also a much higher level of participation amongst the patients. Taking a look at one piece of patient satisfaction can also be safety, and what we're choosing to focus on in the safety aspect and the linking to our everyday practice is falls. So the CDC states that falls are one of the most expensive injuries that exist within a hospital facility, and that a great deal of falls, and according to their information, 20% of them lead to a significant injury such as a hip fracture or head injury. With the information that we've gathered, both based on all types of data collection schemes, including qualitative and quantitative, what we want to see happen is for our study to influence administrators and nurses throughout the entire practice to begin taking a better look at what implementing bedside report could do for their floor. Getting to our research question, our question reads, will the implementation of bedside report within the acute care setting improve the level of patient satisfaction within the unit in comparison to a pre-implementation state? So to put that into different words, what we want to see happen is we want to see patients feeling an increase in their participation of their treatment and care plan. We want them to know who their nurses are at all times. We want to feel that they have a say in the treatment that they are receiving, and we want to see a decrease in various negative consequences of hospitalization, such as, but not limited to, falls, pressure injuries, and infection.
To support our study and the proposed change to bedside shift report, we reviewed 5 articles in research literature to help support and give evidence to implementing bedside shift report. The first study is a qualitative study that was done, and the title is A Qualitative Study of the Changes Shift Report at the Patient's Bedside. The writers of the articles, Grimshaw, Hatch, Willard, and Abraham. The purpose of this study was to discover and identify factors and acute care nurses' perceptions influencing the consistency and frequency of changes shift reporting at the bedside. The study found was that through open-ended questions and surveys given, nurses were resistant upon first implementation, but in the end did agree that bedside reporting improved patient and family satisfaction. This is relevant to our study because it supports the proposed implementation of bedside report and supports that it does improve patient satisfaction. The second article, titled A Quantitative Assessment of Patient and Nurse Outcomes of Bedside Nursing Report Implementation, from the Journal of Clinical Nursing, written by San Jacqueline and Sherman, a quantitative study, was designed to quantify quantitative outcomes of a practice change to a blended form of bedside nursing report. This study found significant improvements post-implementation in 4 patient survey items. Nurse perceptions, patient satisfaction, and a decline in falls were all positive effects of this study. This is relevant again to our implementation of Bedside Report because it gives us statistical data showing that there is an increase in patient satisfaction by implementing Bedside Report. The third article that we researched was utilizing BedShift Report to improve the effectiveness of shift handoff. This came from the Journal of Nursing Administration. The authors are Cairns, Dujak, and Hoffman, and Lorenz. It was a quantitative research project. The purpose of this study was to evaluate the effects of redesign of shift handoff report on effectiveness and efficiency, measured by the amount of end of shift overtime, frequency of call light usage, change of shift times, patients' perceptions of being involved in their care, and staff perceptions of its effects. This study found that patient satisfaction was positively impacted by the implementation of Bedside Report. During the post-implementation phase of this project, there was an increase in the mean patient satisfaction score on both questions related to patients being informed and included in their treatment plan. This is relevant to our study because it gives us data and evidence supportive of an increase in patient satisfaction. Because of the outcomes resulting from this project, Bedside Shift Report was also being expanded to other units in their hospital, which shows that it had a positive effect on patient satisfaction for them to expand to other units within their hospital. The fourth article that we researched was titled Feasibility, Appropriateness, Meaningfulness, and Effectiveness of Patient Participation at Bedside Shift Reporting. The authors are Malfate, Van Heckel, Van Bison, and Lust. Came from the Journal of Advanced Nursing. This study was a mixed method, a match-controlled longitudinal study. The study's purpose was to evaluate the feasibility, appropriateness, meaningfulness, and effectiveness of bedside shift reporting in a minimum of 5 interventions and 5 control wards. This study findings were that bedside shift report is seen as the intervention that improves both nurse-to-nurse communication and nurse-to-patient communication. This improvement in communication has had an impact on several factors that improve patient-related, clinical, and nurse-related outcomes. The relevance of this is that this study addresses the methodological limitations of previous small-scale, non-controlled, quantitative outcome-oriented studies. A wide range of variables are taken into account in this study and report an in-depth image of the effects of bedside shift report, and it gives greater insight into the process of improvement. This study gives us the ability to expand on quantitative data and shows that we're able to improve patient and nurse satisfaction and communication. The last research article that we looked at was titled Implementation of a Modified Bedside Handoff for a Postpartum Unit from the Journal of Nursing Administration. It was written by Wallenhup, Stevenson, Thompson, Gordon, and Nunn. It was a quantitative study. The purpose of this study was a quality improvement project that wanted to successfully implement a modified bedside handoff model with some report outside and some report inside the patient's room in a postpartum unit. Through all these studies, it appears that most nurses prefer some inside and some outside the patient room because there's some areas sensitive that we do want to protect the patient from hearing. We don't want the patient to be offended. So the secondary aim was to improve patient and nurse satisfaction within bedside reporting by developing, implementing, and evaluating the use of an S-bar structure and a hybrid bedside handoff between nurses on the postpartum unit. This study showed that there were significant increases in reported satisfaction for all items evaluated for both patients and nurses. Patient satisfaction scores increased by 28%, and staff satisfaction scores increased by 40%. Both patient and staff satisfaction increased after the implementation, and we were able to see this with statistical significance. The relevance to this, as well as the rest, it is supportive of patient satisfaction. The results show an increase in patient satisfaction with numbers and percentage, and this shows us that bedside reporting does improve patient and nurse satisfaction.
In order to increase patient satisfaction, we would like to propose the plan of taking shift report from outside of the patient's room to the patient's bedside. In order to collect data for the study, a baseline questionnaire will be given out to patients during discharge in order to gain an understanding of their current satisfaction level while traditional report is still being used. The same technique will be used to obtain data once bedside report is implemented. A questionnaire will be distributed to patients upon discharge to gain an understanding of their satisfaction level. The collected data will be compared and analyzed, and multiple factors will be looked at, including patients being aware of who their nurse is, their plan of care, if they felt included in their plan, and if they felt safe. Once all the factors are weighed, it will then be determined if this new method will be implemented for good into our practice. Before implementing bedside shift report, a few important factors needed to be reviewed. The first factor is what resources will be needed to implement the change to bedside shift report. The first resource that we'll need are participating staff. This includes training staff members who will be training others, floor nurses who will carry out this new method of report daily, bedside report champions. These will be the resources for other staff members that may have questions or need further guidance, and nurse educators and managers who will supervise the change and be available to provide feedback. The second factor are costs. Costs to copy and print materials, more specifically flyers that will be hung around the unit to remind staff that bedside report is now being implemented. Printed instructions for users to properly implement bedside report, and standardized report sheets for nurses to bring to the bedside to guide them through the new report method. The third factor is how will stakeholders be affected? There is potential for prolonged report times. There have been concerns regarding HIPAA violations and waking the patients. There will be proper introduction of patient and the oncoming nurse, an increase in patient and family participation, early assessment of patient and the environment, which will give the nurse the opportunity to check the bed alarm, IV access, running medication drips, tubes, wounds, skin, etc. The nurses will be able to immediately address the patient's immediate needs. For example, if the patient needs to use a restroom or an extra blanket. It allows the oncoming nurse to clarify with the previous nurse any conflicting information, and it also gives mentoring opportunities for novice nurses to watch and learn from experienced nurses. The fourth factor is how will bedside shift report be implemented into the practice? So the idea of bedside shift report will be introduced to the staff during shift huddle months prior to implementation. This allows the staff to get comfortable with the idea of change and know what to expect. Then they will be trained through mock bedside reports, which will be held in order for staff to practice and feel comfortable prior to actually doing the report at the bedside. Flyers will be hung to remind staff to take their report to the bedside. A standardized report sheet for the nurses will be printed off to use during report for guidance. Nurse managers and educators will be on site to supervise, assist, and provide feedback, and bedside shift report champions and resource nurses will be there to assist other staff.
So when we get to the integration and maintenance of introducing this practice as policy, we're going to have to take account into a various amount of things. For one, there will be questions about cost in regards to the implementation of bedside report. There have been rumors and there has been discussion that perhaps the implementation of bedside report equates to an increase in RN overtime. However, according to Grimshaw et al. And also Sanjacklin and Sherman in 2014, this simply is not true. Baseline facts would be provided to administration and any other members that are vested in the facility so that they receive similar teachings that the RNs and PCAs are receiving. This would ensure that they are privy to how everything is being conducted and that they would be able to see what is expected of our staff and also see the data to back up why we're doing what we're doing. It would be our hope that in seeing the role model training method put forth, that they will get an idea of what it would feel like to be the patient, but also how an RN is perhaps better able to meet a patient's needs and ultimately lead to an increased satisfaction. Previous statistics would allow us to infer that our hypothesis would most likely be correct. And from that, we would be able to help with beginning to implement this into a policy rather than just as a study. In doing so, we would have to have a cohesive collaboration with the majority of the hospital staff. The training department would be extremely important for all new hires and would be requested to incorporate the proper way to do bedside report, including the role play method within the orientation curriculum for new hires. And also an on-site clinical education will also be present to aid in any questions that staff may have in regards to the proper implementation of bedside report. Sharing policies early will typically have a higher chance of allowing them to be carried out correctly, and this is for Boswell and Cannon, 2017. Prior to meeting with any floor nursing staff, there would need to be administrative meetings to ensure that everything in the procedure was proper. So before the policy is brought on, we would have to present all potential benefits to the people that are vested in the company so that they know why we're completing what we're doing. Being able to show them not only the increase in the amount of satisfaction the patients will have, but also cold hard data in regards to things like infection rates, falls, rapid response outcomes, and CAUTI and CLABSI rates, and also pressure injuries, all of which equate for a high amount of cost for the hospitals to pay for, as these are hospital acquired more often than not. This would show the cold hard data of bedside report would really help the administration get on board and help push the policy being carried out. There will be meetings with the nursing staff prior to the administration of this policy, and there will be ongoing role playing based on the feedback that is given based on the quality report that patients give. There will be bedside champions available that will help in not only aiding the staff to properly implement report, but also will go around and survey patients to ensure that bedside report is happening in a proper fashion so that retraining can occur with staff that are perhaps not properly implementing the technique. Fall totals, infection totals, and patient satisfaction on top of other possible negative outcomes of hospitalization will be tallied throughout the implementation of bedside report. Each month, these stat data will be emailed to everyone within the hospital, from PCA all the way up to administration, to show how bedside report is affecting the outcomes of patients that are housed within the facility. Hopefully that will demonstrate and cause the motivation to continue the implementation of a policy. Because one concern of this particular study is that once it's over, perhaps some of the hype will die down, as there's always a new focus within the hospital setting that may take over the new and exciting thing with the staff. So having things like bedside champions and also clinical education involved will allow that there's still a focus on bedside report occurring.